As a doctor, I have done countless pelvic exams when the uterus is not in its normal position. But please do not panic. Having a uterus that is not in the normal anatomical position is an extremely common thing. The position of your uterus affects the direction in which your cervix is facing. And the position of your cervix may have implications on how easily the sperm cells are able to enter into your womb through the cervix. If the sperm cells cannot get into your uterus because of how your cervix is facing, let's face it, pregnancy is just not going to happen. This is the normal position of the uterus in its anteverted position. What happens during intercourse? As the sperm enters the vagina, it will meet a cervix that is directly opposite to the vagina. And so the sperm cells don't have to stress themselves. The entrance to the uterus is very obvious and apparent to them, and they can go straight in. The sperm meets the cervix, which is in this position right here. So it's easy for the sperm cells to swim in through the cervix, and voila. This is the start of the magic happening quite easily. In comparison to the retroverted uterus. In this picture, you can see the position of a retroverted uterus in comparison to the normal anteverted position of the uterus. The retroverted uterus can be described as the uterus being tilted backward so that it aims towards the rectum instead of forward towards the bladder. And then the next picture we have describe what we call a retroflexed uterus. With this position of the uterus, the fundus, which is the top of the uterus itself, is tilted or bent towards the spine. And in some instances, the fundus of the uterus may rest against the rectum. Here is another picture that will help you to understand the position of the uterus and how it impacts the direction in which the cervix is facing. So you can imagine if the opening of the cervix, which remember is in between here, is resting against the vaginal wall, it's naturally going to be much harder for the sperm cells to swim their way into the cervix in order to be able to enter into the uterus. So with these altered positions of the cervix in retroflex and retroverted uteruses, there is sometimes no room for the sperm cells to swim their way into the entrance of the cervix and into the uterus. So in these women, the sperm cells will lurk around for a few days, usually 5 days, and after that, as they are not able to swim their way through the cervix in order to be able to get into the uterus, they naturally die in a vagina, not having achieved their purpose. Knowing what you know now, it's important that you go to your doctor and ask for a routine pelvic examination. That will also include a vaginal examination, as well as your doctor using a speculum to go into the vagina, because only after your doctor has used a speculum and goes into the vagina and opens up the wall of your vagina, will he or she be able to tell what side your cervix faces. Now remember, the position of your uterus will affect what side your cervix faces. Even after having a vaginal manual examination and the use of a speculum, it's important, if you're struggling to conceive, of course, for your doctor to get you to do an ultrasound scan. The ultrasound scan will tell with precision whether your uterus is in a normal position, retroflex position, or in the retroverted position.